Right, but we're going to go ahead and bring in Mark Scott
Right.
from the Guam National Guard to bring us up to speed with what's happening with our men and women in the National Guard. Good morning, Mark.
Hey, good morning, Sabrina. Hi, Chris. Hi, Jason. How are you guys?
We're doing pretty good. Hope this morning's finding you well. Mark, we'll just get right into it. We know, and we've heard, from you and others, that several members of the National Guard, the Guam National Guard, have tested positive for COVID through the public health testing. So, what can you tell us about that situation, and has it changed since we last spoke to you a few days ago, where you told us I think there were three positives in the Guard?
Well, we have one positive in the Joint Task Force, and that's the important number, Chris and Sabrina, and I'll tell you why. The one positive on the Joint Task Force is the one who's, the Joint Task Force is public facing, right? That's the task force that's on orders, they're activated. The rest of the Guard population, it's important to know, they're on a civilian status if they're not on orders. If they're not a part of the JTF, they're just like the rest of you guys that have their civilian boss or have their own medical rights to privacy. So if these people that are not activated choose to go and get tested, they choose to go and get tested, and they have that HIPAA rights to privacy. So the numbers that we do report, Chris, is the one positive that we had in the JTF last week. That individual is isolated in quarantine, and that's the number that we are reporting. Everything else gets reported through public health,
Right.
The rest of our force that's on civilian status.
Right. So I know what you're reporting, Mark, but we hear the ripples through the Guard community, which, we all know someone in the Guard, right? I know, God, plenty TT, let's just put it that way. So what's the conversation
Sure.
like in that community, whether or not they're active duty? I know you have friends too. People are talking. What are they saying?
I do, and rumors are always going to be rumors, and of course, it's good to be as informed as we can. But like I said, those soldiers and airmen who were not activated under the JTF, if they're civilians during August and September drill, they're civilians, right? They have their own private employers, they have their own private lives, and.
But do they have a duty to report this to the Guam National Guard if they test positive?
No.
They don't have to.
Wow.
They don't. So they're not under, like I said, they're not under
Yeah.
orders. They're civilians.
So when
yes.
you mentioned 3 over the weekend, that was just you misspoke?
No. So we're aware of the 3. Yes, of course. If our Guard community is testing positive, and they choose to make it known, it's their protected health information that they can choose to disclose, right? So we're tracking 3 total. If there's other folks out there that just decide to go and get tested today and choose not to disclose that protected health information that they have, then of course we're not going to know.
So if I'm not active duty, but I have a meeting with the adjutant general, I don't have to let her know anything that, hey, I tested positive previously, like a week ago or 2 weeks ago, or
No. So that's a little bit of a twist, Sabrina. So if anyone tests positive, we all know that these people go right into quarantine, right?
after
And it doesn't
after
take-
they're done with their quarantine, you just don't have to report anything. That just doesn't seem right.
I'm not sure I understand your question.
That's the policy. So when you're a civilian, anything going on your civilian side, you're not obligated to report to your Guard command.
Yeah. So that's correct. That's right.
All right.
And then when you're activated, say a month later, you don't have to disclose anything that you had previously tested positive.
So the key here, guys, is that our Joint Task Force is the one who was public facing.
Right.
Those are the ones that we really need to know interacting with
I
the
got you.
community.
Where do the Guards members get tested? Do they get tested at Naval Hospital or their private clinic?
So, like I said, if the Guard members are, we call it IDT. They're part-time weekend warriors. They come in for weekend drill. As a civilian, they have the right to choose where they get tested.
Okay.
Yeah.
What if they're active duty Joint Task Force members? Do they get tested?
So, the Joint Task Force has conducted its own internal training or its own internal testing with our medics that have been trained, and yeah, we'll continue to be doing that as we go. We'll continue to get our own internal testing done. We can also, if we choose to, go get tested at the public sites, and we the same options that anyone else would have. So we need to go and get tested.
So the National Guard does its own internal testing. Is that what you're saying?
We have in the past, and we've also gone outside to do testing at other testing sites as well.
When did you guys stop? Or are you guys still doing it?
There's always ongoing testing.
But is that on the Joint Information Center report?
Sure, all the tests all get rolled up and they get sent to public health for their statistics, for their tracking.
Okay, let me just pull this up real quick.
When I
So-
talk about doing our own testing, Sabrina, we can swab, but of course the results go back to, the the Diagnostic Laboratory Services.
DLS,
and
right.
all the other. right,
Okay,
places
because
where
it
they-
says like Guam National Guard Laboratory. So no new cases reported, 0. Samples tested on the 17th, 0. So you guys, I think it's always been 0 for quite a long time.
Yeah, you guys, is it? I remember
think
we
we
talked
had a
about
conversation,
this.
yeah, that
you
you
don't
guys had
have
stopped.
testing or.
Had stopped testing. Because I was asking when the governor had mentioned during a press conference that the National Guard was going to be testing GPD, they were going to be testing GFD, and it turned out that the National Guard wasn't going to be doing the testing.
When was this from, Sabrina?
Well, when we
Can I ask?
interviewed you,
I think it was the
Boy.
first interview with you.
yeah.
So basically, you guys
Yeah.
have a lab, but you're not doing any testing. And I believe you might have said it was because public health was just more of the testing authority.
Yeah,
Well, let's just make this
Yeah.
easy. How come you guys aren't doing testing if you have a lab?
We are not testing the larger public because we're playing a support role to public health.
but you guys
So our
are testing your own people.
Yes, we have
Interesting.
trained medics who were swabbing, not doing the complete test, but we're certified to swab, which is why we were assisting, for example, public health's efforts to test the prisoners at DOC,
Okay.
because
So-
we have medics who were trained to do the swabbing. Now, we talk about cradle to grave, the whole entire test, including the laboratory results. No,
Okay.
we don't do that standalone or independently.
So
But
you
we
don't do
provide
internal testing.
No, just the swabbing part, and then the results get sent off.
Right. Okay. Yeah, that's what I was confused about. I thought you said you were doing internal testing. So it's like, well, there's no numbers that are on the JIC report that would indicate that you guys
Right,
are doing
yeah.
internal testing.
Yeah, that's probably the miscommunication there, is that we do the swabbing,
Right on.
But- right? The test gets sent off like all the other tests.
Right. Okay, Mark.
Yeah, Mark, let's just, I guess, last question. We wanted to bring you on, and I get it. You can't say too much, right? Because we've already had public health tell us that, it's guard and dependent. So I understand you're limited in what you can say. But let's just talk PCOR 1. Going PCOR 3 to PCOR 1. How's the posture, the operations with the guard change? What type of assistance are you guys now offering now that we've had this status change?
Sure. We're always looking to protect the force, Chris and Sabrina. That's General Agagi and Colonel Delphin's watchword is protect the force. So we're always leaning forward to mitigate risk and look how can we keep ourselves safe? How can we keep ourselves healthy so that we continue to serve as we've been charged to do, right? If we go down, we can't do our job. So we've done things like increased telework. We have a joint task force split up into 2 teams where one team will telework and one will be present. And that cuts the risk in half. If one of the teams has an infection, the other team can continue to work. And all these things, we've increased the safety measures here on our compound, our complex, where it's essential workers are coming in. We did leave the gas station and the AP shop open to authorized card holders. But of course, we're enforcing the social distancing and the wearing of the mask and things like that. So we have our risk mitigation in place. It's very important to us. As I mentioned, our leadership cares about protecting the force because if we don't do that, then we can't do our job.
Right on, Mark.
All right. Thanks, Mark, for everything you guys are doing.
Yeah, thank you guys too. We appreciate it. And stay safe, take care. Wash your hands, wear your mask.
There you go. Stay home.
Stay safe.
I feel like it's a race.
Stay home. Okay, have a
Take it
good
easy,
morning,
Mark.
you
You
guys.
too, man.
Good morning.
8:51. Okay. Let's go to the Zoom room and we're just trying to round up all the different people that have been hit with this rash of positives. We had Superintendent Fernandez, obviously Mark Scott.